If you've been to a healthcare facility lately, maybe you've noticed it. The return of masking in BC is becoming mandatory next week.
Many now wondering whether Ontario will follow suit. CTV's health reporter Pauline Chan has more.
BC's medical officer of health, Dr. Bonnie Henry, says the mandatory masking rules apply to hospitals, long-term care settings, and clinics.
To everybody in the healthcare setting, in patient care areas. So in areas where we know there are people who are most at risk of having severe illness or complications from all of the viruses that we tend to see circulating this time of year.
And while the rules in BC call for full-time masking by staff, volunteers, contractors, and visitors in these areas, others will be less strict. For example, in long-term care, residents are in a place that is their home, so visitors will be required to mask up, but residents may choose to go without, depending on their doctor's advice.
Patients, for example, who are coming into an emergency room, they can't always put a mask on. It may be trauma, it may be the reason that they're coming in, but absolutely, if somebody's coming into the emergency department, sitting in the waiting area, we will expect most people to be wearing masks.
Here in Ontario, many hospitals still have that in patient-facing settings, but I think they're reintroducing it in BC because it had stopped. And right now we're already starting to see a surge in respiratory viruses.
Dr. Lisa Solomon, who works at several Toronto hospitals, says patient-facing areas have maintained masking requirements through the pandemic, but did relax the policy in some areas, like the cafeteria or research areas. Solomon adds now is the right time to bring back masking in Ontario for all areas where patients are found. Pauline Chan, CTV News.